Hello everybody and welcome back to What the Health with Dr. L, where I share with you brief evidence-based answers to important health and wellness questions. And today's question is, why should I care about my blood pressure? The short answer to that, we all should care about our blood pressure because blood pressure is a silent killer. So many people have no symptoms, they feel good, they are not diagnosed with any serious diseases. All of a sudden they end up with a heart attack, with a stroke, with a blood clot, a serious blood clot that could be very dangerous and that might lead to serious complications, including death. That's why it's, even though we might not be feeling any issues, it's always a good idea to check our blood pressure from time to time. Usually I would recommend checking blood pressure 3 times a week in the morning, just when you are more relaxed. Just check it and record the reading. According to the latest guidelines, we would like for most people for their blood pressure to be around 130/80. The top number 130 or less, and the bottom number is 80 or less. Some people might be able to tolerate a higher blood pressure, up to 140/90. Of course, everybody is different depending on many factors. So that's why I'm not a strong advocate of rigid numbers. I'm a strong advocate for a lifestyle that is conducive to a normal blood pressure that works for me personally. Constant blood pressure would lead to damaging the inner walls of the arteries. Our arteries, these are the little rivers that take the blood from the heart all the way to the rest of the body, to our brain, our kidneys, our liver, and the rest of the body. So when this damage happens in the inner walls, we end up having cholesterol deposits to seal that damage. These cholesterol deposits over time, because of high blood pressure, they might turn loose and block the artery. If that happens in the heart, that would cause a heart attack. If it happens in the brain, that would cause a stroke and paralysis, loss of movement. If it happens in the lung, it might cause a clot in the lung, lung embolism, which could be life-threatening. This is in brief why should we all care about our blood pressure, especially if we come from a family with a strong history of high blood pressure or heart problems or kidney problems or strokes and so on. In the next time, I will share with you some strategies, some ways to make sure that we keep our blood pressure in check within a good normal range that works for us, depending on our age group and also depending on our lifestyle. I hope that helped to clarify why is it important to keep an eye on our blood pressure regardless of our age. I wish you all well and see you next time.